Welcome to this comprehensive walkthrough of the Dexup DVT pump system, designed to help prevent deep vein thrombosis, a serious yet preventable condition in immobilized patients. What is DVT? Deep vein thrombosis, or DVT, occurs when a blood clot forms in the deep veins of the legs. This condition can block normal blood flow, leading to swelling, pain, skin discoloration, and, if untreated, life-threatening complications like pulmonary embolism. Why use a DVT pump? Without prophylaxis, DVT can cause venous hypertension, rupture of superficial veins, chronic swelling, and post-thrombotic syndrome, or PTS, which affects up to 60% of DVT patients within 2 years. Mechanical prophylaxis, such as intermittent pneumatic compression, IPC, via a DVT pump, has been clinically proven to reduce DVT risk, particularly in postoperative or immobile patients. Let's move on to unboxing. What's in the box? Your Dexup DVT pump kit includes 3-port air hose, the sequential DVT pump unit with integrated power cable, and medium-sized thigh sleeves. How to set up and use the sequential DVT pump. Connect the hose pipe properly to the ports on the pump as shown in the video. Now open the hooks and mount the pump securely to the bed rail using the provided hooks. The sleeve wrapping shown is for demonstration only. In actual use, wrap directly on the patient's leg, below clothing. While wrapping the sleeve, ensure that the V shape of the sleeve comes on the calf and back portion of thigh and hole at back of the knee. Now wrap the sleeves to each leg. Maintain 2 to 3 fingers gap between the sleeve and leg. Connect hose pipe to sleeves properly as shown in the video. Turn on the button which is at the side of the pump. Long press the green colored start button on the display panel. Now after 3 to 5 seconds the pump will show green light auto confirming that both sleeves are well connected and properly inflated and deflated. Default pressure is set to 40 mercury. For sequential pump, pressure in the sleeve builds up sequentially in +5 and -10 proportion. For example, when you set pressure to 40 mercury, then at ankle portion pressure will be 45 mercury, at calf portion pressure will be 40 mercury, and at thigh section it will be 30 mercury. You can change pressure from 30 mercury to 60 mercury for calf sleeve and thigh sleeve from display panel buttons. Now if you want to attach only single sleeve to pump, follow these steps. Before starting the pump, only wrap one sleeve to the leg. Now attach the air hose pipe to one sleeve and turn on the pump. The pump will detect the single sleeve, show the green light on the display panel and start the compression cycle. This is all the information you need to install and operate the Dexup DVT pump properly. If you have any questions, you can email us on sales@dexup.in or call us on +91 738 530 4200.